Sleep is crucial for both physical and mental well-being, yet many people struggle to get enough rest each night. One common question is whether getting just 5 hours of sleep each night is sufficient and what impact it may have on your health. The short answer is no. 5 hours of sleep is generally not enough for most adults, and consistently getting this amount of sleep can have significant negative consequences for your overall health. Experts agree that 5 hours of sleep is too little, particularly when this becomes a regular habit. Dr. Shelby Harris, a clinical psychologist specializing in sleep medicine, emphasizes that 5 hours of sleep is too few, especially if this is a frequent occurrence. While individual sleep needs can vary based on factors like age, genetics, and health, the consensus is clear. Most adults require more sleep to maintain optimal health. In fact, according to Dr. Banu Kalla, a sleep specialist at the Mayo Clinic, most healthy adults naturally need between 7 and 9 hours of sleep per night to function at their best. There is, of course, variability in sleep needs. Some people may feel rested after 9 or 10 hours of sleep, while others can function with as little as 5 hours. However, consistently getting too little sleep can lead to long-term health issues. In rare cases, there are individuals with a genetic mutation that allows them to function on less sleep without suffering negative health effects, but these individuals make up a very small portion of the population. For the vast majority, 5 hours of sleep per night simply isn't enough to support bodily functions and cognitive health. When people regularly sleep only 5 hours a night, the results can be detrimental in both the short term and long term. In the short term, sleep deprivation can have a noticeable impact on cognitive function. People who sleep less than the recommended 7 hours often struggle with focus, memory, and slower reaction times. They may also experience increased irritability and emotional instability. This can significantly affect productivity at work or school, and may even lead to poor decision-making and mistakes that could be costly in both professional and personal contexts. Furthermore, lack of sleep has been shown to increase the risk of accidents. Sleep deprivation can impair motor skills and judgment, making individuals more prone to accidents, including falls and car crashes. Research has found that sleep deprivation can have effects on the brain similar to those of alcohol intoxication, raising the likelihood of serious injuries due to impaired coordination and slowed reflexes. Over time, chronic sleep deprivation, such as consistently getting only 5 hours of sleep a night, can lead to serious health problems. These include an increased risk of hypertension, heart disease, stroke, kidney disease, and diabetes. The link between inadequate sleep and these conditions is well documented, with sleep deprivation contributing to higher blood pressure, inflammation, and metabolic disturbances that can exacerbate these chronic illnesses. Mental health also suffers greatly when sleep is inadequate. Chronic sleep deprivation is strongly associated with an increased risk of mental health disorders, such as depression, anxiety, and bipolar disorder. In fact, ongoing sleep deprivation can even contribute to the development of neurodegenerative diseases like Alzheimer's. This is particularly concerning given the growing body of research showing that sleep plays a vital role in cognitive function and memory consolidation, and that consistently depriving oneself of sleep can accelerate cognitive decline. Even if you're not experiencing these severe health issues right now, consistently sleeping only 5 hours per night can still be damaging in the long run. While you might not feel the immediate effects of sleep deprivation, the cumulative damage builds up over time, making it increasingly difficult to recover. Experts warn that if you're not getting enough sleep and don't make an effort to catch up, you could be setting yourself up for serious health problems in the future. It's important to note that the recommended amount of sleep varies based on age and individual needs. Infants and children require far more sleep than adults, while older adults may require slightly less. The National Sleep Foundation and the Centers for Disease Control and Prevention, CDC, provide general guidelines on how much sleep different age groups need each day. Infants, 4 to 12 months, 12 to 16 hours, including naps. Toddlers, 1 to 2 years, 11 to 14 hours, including naps. Preschoolers, 3 to 5 years, 10 to 13 hours, including naps. School-age children, 6 to 12 years, 9 to 12 hours. Teenagers, 13 to 18 years, 8 to 10 hours. Adults, 18 plus years, 7 or more hours. The ideal amount of sleep is the amount that leaves you feeling rested and alert the next day, with enough energy to function effectively throughout the day without experiencing overwhelming sleepiness or the need for naps. If you're regularly sleeping only 5 hours, it's crucial to recognize the potential long-term risks and negative consequences for your health. While occasional short nights may not cause immediate harm, consistently failing to get enough rest can severely impact your cognitive abilities, physical health, and mental well-being. To avoid the devastating effects of chronic sleep deprivation, it's essential to prioritize sleep and make the necessary adjustments to your lifestyle and environment to ensure you're getting the rest you need.